I am Dr. N.V.R. Murthy. I am a gynecologist and gynec oncologist by profession, self-trained in gynae oncology in different institutes. I am working as a consultant at this hospital in St.Theresas hospital for the last 10 years. I am having total 28 to 29 years of experience. Cancer cervix is the second most common female cancer in India. The incidence is about 17 to 18% of all the female cancers, the breast carcinoma being the most common. About 28% of the females will have, 28% of the cancers in females are due to breast carcinoma. Earlier the CS cervix used to predominate. Since the last 10 to 15 years, the breast carcinoma has overtaken the cervical carcinoma. The cervical carcinoma is commonly caused due to HPV infection in about 90 to 95% of the cases, and this HPV infection is similar to any other virus infection and is of two types, low risk type and high risk types. This infection is usually may not produce any symptoms in the lady except for some mild soreness or discharge per vaginum. Most of the infections are asymptomatic in 80 to 90% of the cases, and because of the patient's good immunity, these infections get corrected on their own within a span of 2 years. In some women, this infection persists, and over a period of 8 to 10 years, it induces changes in the cervical cells, producing pre-cancer or zero-stage cancer or cancerous growth. These cancerous cells are continuously exfoliated or expelled from the surface of the cervix, which can be examined by us through a pap test or a HPV screening test. This pap test is a collection of cervical smear from the surface of the ectocervix. This involves insertion of a small speculum and taking the sample. This is a painless procedure. Patient may have some mild pressure, otherwise it's a simple procedure, OPD procedure. After collection of the specimen, we send it to the pathology lab for cytology, and they give whether there is any changes of cervical cancer changes or not, or a precancerous changes. The HPV testing also will show whether the high risk HPV type is there, in which case the chances of persistence of infection is more. After this screening test, we have to confirm whether there, through a biopsy by a colposcopy, whether it's truly precancerous or cancerous. This colposcopy involves examination of the cervix under magnification with a small scope, and taking biopsies about 3 to 4 millimeters in size. Is a painless procedure similar to the pap smear collection. Patient need not feel apprehensive about that. Once the confirmation is done by the colposcopic biopsy, we treat according to the condition of the cervix that comes out in the biopsy. If it is normal, we can keep it under regular screening procedures of pap smear every 3 years, and or an HPV test every 5 years from 30 years of onwards. If these cervical changes are zero stage cancer or CIN, in that case we can do a cold burning the cervix with cold ice about minus 20 degrees centigrade, or giving a diathermy treatment or giving heat to the cervical tissue, or we can remove a small slice of cervix through a thin loop. And in most of the cases, hysterectomy may not be necessary unless the patient desires a hysterectomy, or when the follow-up is problematic for the patient. Very rarely we go for a hysterectomy. CA cervix is caused by HPV infection, as we have already discussed. It is a virus. It is similar to other viruses like influenza, chickenpox, polio, etc., or even COVID. You see, before exposure to any disease, we always take vaccines so that when the exposure occurs, the disease will be milder in nature, or it will not have serious consequences to the public. Similarly, when we want to prevent CA cervix, before the children, the girls, go for marriage, at that age, if we give the vaccines, either 2 or 3 doses, then this will develop the girls will develop some immunity, and when the sexual exposure occurs, at that time the HPV infection, even if it occurs, it will result in a mild disease, and the persistence of infection will not be there, and even the high risk virus types also will be eradicated from the cervix. This is the basis for giving HPV vaccination. In less than 16 years of age, we give 2 doses of HPV vaccine 1 to 6 months apart, and more than 16 to 26 years, we give 3 doses 0, 1 and 6 months apart. So if you as mothers you are coming to hospital for a screening test for cervical cancer, you can bring your young daughters or young relatives to the hospital for HPV vaccination, so that this will also prevent CS cervix and will help us in global elimination of CS cervix. Thank you.